of Florida. So we thought this would be a great opportunity to share what we learned and inspired us for those of you that attended, as well as for those of you that did not attend, but are thinking of possibly joining next year, which is in Denver, Colorado. So we're hoping that you put this event on your calendar, as there is so much information to learn and lots of networking to do. So today we have our panelists here that will be sharing our perspective, and we welcome everyone to join in the discussion. So you can definitely just listen, or you can absolutely open up your mic and ask questions as well. Oh, I'm sorry, we are not opening up our mic just yet. You are going to raise your hand, and Terry, our director of the Illinois Academy, is going to be monitoring that. If you're comfortable, definitely open up your video as well so that we can see you. And so to get started, each panelist is going to introduce themselves and share a little bit what their lens is and what they looked at with FNCE, because we know that dietitians can work in so many different areas. And then after that, we're going to be asking specific questions, and each panelist is going to be answering the questions. And if we have time at the end, if you have any additional questions to ask the panelists, or just wanted to share your experience with FNCE, we can do that as well. So without further ado, I'm going to start with the introductions, and then we're going to work through the panelist list. Just going to switch to the next slide. Okay, great. So as I mentioned, my name is Val Chudzinski. My day job is I'm a regional clinical nutrition manager, and I'm fortunate to lead 11 dietitians on the inpatient side and outpatient oncology. I've been a dietitian for 17 years. 9 of that was as a clinical dietitian. And then 8 of those years I've been in leadership. My focus this year, when I was looking at the program for FNCE, was really looking for anything with malnutrition, because we know that inpatient dietitians eat, sleep, and breathe malnutrition. Informatics, and just areas that would improve productivity and anything innovative to share with my group. Charlene, would you like to go next with your introduction?
Sure. My name's Charlene Ware. I'm actually the president-elect for the IAND. And full-time, my job is at SIU School of Medicine here in Springfield. I work in the culinary medicine program, where we teach nutrition to residents and med students. And I also see patients in internal medicine that range from diabetes to obesity to people needing to gain weight to celiac disease, just you name it, a little bit of everything. So I went to FNCE just really interested in learning more about obesity and diabetes and all those things that would help me in my current position. And I was really, I felt like I learned a ton, was really happy that it was in person this year. I felt like I just gained a lot more when it is that way. So happy to get to go, and thankful that IND sponsored me to go as president-elect.
Thanks, Charlene. Sarah, would you like to go next?
Yep, so I'm Sarah. I am the immediate past president. I went to FNCE this year. Our president was unable to go, so I stepped in last minute to attend. I have been a dietitian for almost 6 years. I work for OSF Healthcare, St. Luke Medical Center, and rural Illinois in Kewanee. And the Illinois Academy sponsored me to go this year.
Christine, would you like to introduce yourself?
Sure. My name is Christine Cliff. I'm a dietitian for about going on 19 years. My full-time job, I work in school nutrition, so a little bit different from everybody. So pardon the hat. So I have to keep my hair out of the food. It's always good. But I work in Elgin, Elgin U46. We're the second largest school district here in Illinois, outside of Chicago. We have 55 schools total, 41 elementary and 14 middle school, high schools. So pretty busy. Work a lot with food allergies with our students, which seem to be on the uprise. Just trying to work with menus, trying to meet the USDA Child Nutrition Program guidelines for National School Lunch, School Breakfast, and or after school supper programs. Been throughout my career, been in clinical, long-term care, industry, education, and beyond. So I think I've hit it about all. So garden variety of experience. I was very honored to go to FNCE. It was actually part of the Leadership Institute that Illinois Academy sponsored me for when I was president at the time, a couple years ago. I was president of Illinois Academy in 2019-20. So part of the Leadership Institute at the time was to go to FNCE in person. Well, we had COVID for 2 years. We couldn't go. So this was finally the opportunity I was able to go on behalf of the Leadership Institute and Illinois Academy. So had a great experience. I've gone to several FNCEs over the years, over the 19 years. And actually my first one was as a student back in 2002, I think. It's been a few years, been a minute. So it's been a great experience. I too went to a lot of sessions, and I'll highlight a few here in a few minutes. So thank you.
Thanks, Christine. And Mary, take it home for us.
Oh, thank you. Hello, everyone. I'm Mary Russell. I've been a dietitian for 38 years.
Awesome.
Impossible to believe, and have probably been to at least 15 FNCEs over the years. This one was the first one in a while where I completely self-funded, and we're going to talk later on about what opportunities there might be for individuals who find the cost of going to FNCE a little daunting, which I must say it is especially when you're completely funding it yourself. However, it's just an amazing experience. I am currently have done, like others, have done a variety of things, including clinical and clinical management and industry related work. Currently, I'm an adjunct assistant professor at Rosalind Franklin University of Medicine and Science. So in that role, I teach at various times courses on critical care and also on nutrition and chronic disease. So I focused on attending those types of sessions. But also I am currently the vice chair of the Academy's Political Action Committee and PAC. So I was involved in some policy and advocacy sessions as well. And as a very grateful past president of the Academy, there were a few things that I attended that involved past presidents. So it was a wonderful experience with new and old colleagues in person for the first time in a while.
Thank you, Mary. Okay, so we're going to get started here with just which presentations you are the most inspired by. Each of us chose our top 3 presentations. We know that there was a lot more than that, so it was really hard to pick our top 3, but we wanted to share that with you. And if there's a presentation that you were really inspired by, again, go ahead and raise your hand and we will get to you on here as well. So Mary, would you like to start with the sessions that you found the most inspiring?
Yes, thanks, Val. One of the ones that I found inspiring and sobering as well was actually came about because of my teaching role. There's a lot more master's programs, as you well know, and Rosalind Franklin University has had one for years, and they are now facing quite a bit of competition. So they're considering looking at perhaps starting a practice doctorate at that university. So I thought I would attend the session on the graduate RD programs, and was sobered to learn that only about 3% of dietitians have a doctoral degree. And as you can imagine, in master's programs and certainly in doctoral programs, doctorally prepared individuals are the preferred instructors. So it was really interesting to learn that the Future Education Model program, which obviously involves the master's program, has expanded from 10 to 73 programs in over 4 years. So clearly there's a huge need for doctorally prepared individuals. And it was fascinating to hear the doctorally prepared people speaking, who are all educators, just about the challenges that there does not exist a certification or a global sort of way of establishing what should constitute a doctoral program in clinical nutrition. So as with many things with the Academy, they were forward thinking and created a task force, which is currently working to try to figure out what should be the components of a doctoral program. And it's in progress, as you can imagine. And in fact, one of the individuals said, there's a well-developed technique of inquiry among the members of the task force, which I think is another word for a lot of people have a lot of different opinions, which I think is good. It's actually very good that people are very involved and interested in this. And there really is a call to action for individuals to obtain their doctoral degrees. And of course, they talked about some of the issues related to funding a doctoral program, time away from family and work, and also what kind of a salary will you obtain once you get your doctoral degree, which may be a while for you to recoup, if you will, the cost of that program. So this was, it was something that the chair of the department asked me to attend, and I really was sobered, but also interested in hearing that there are more programs coming online to prepare people, whether it's a PhD program or a doctorate in clinical nutrition program. And potentially there will be some other interesting options as well. So did you want me to go on, Val, with all of them, or did you want to ask someone else to jump in now? I think you're muted, Val.
Thank
Mary, why don't
you.
Highlight your other.
There we go.
Go ahead. Sorry. My screen that gave me the option to unmute was hidden. I'm okay. I'm okay with, go ahead and keep going, Mary. And I feel like maybe pause after each presentation that you discussed. And if anybody else had that on their list or wanted to share their experience with that presentation, we can kind of do a discussion from that standpoint.
Okay, thanks. I know that the second one you actually also attended, Val. So as soon as I say a couple things, I'd love to have you jump in. That was entitled From Consensus to Confident, Improving Nutrition Care of Hospitalized Patients with Malnutrition. And in this case, it was specifically related to adult patients, although it actually is the work that the Academy has been doing on the what used to be known as the Academy Aspen Consensus Criteria for Identifying Malnutrition, and now have been called the AAIM, or the Aspen Academy Indicators for Malnutrition. And it's a huge study that was funded by a number of groups within the Academy to look at validation of those criteria, which I think anyone that works in clinical is very familiar with. And there also was a staffing study component to that. Data has been collected, and the slides were extremely detailed, a lot of information. And there have been the proposal, the initial proposal for the program was actually published in the Journal of the Academy of Nutrition and Dietetics, and the staffing study, as well as the validation study, will be published as well. But basically, the good news about this for me was that the AAIM criteria have been validated in adults. This has been something that people have been concerned about for quite some time, because validation is an important criteria that would take us down the road for reimbursement and other scientifically important criteria. So it was wonderful to hear the details from several speakers about how this validation study was conducted. And a couple take homes were that severe malnutrition is consistent with an increased rate of readmission and an increased number of ER visits, both of which obviously add to cost for the healthcare system and for the patients themselves. And moderate malnutrition, again classified using this AIM criteria, was consistent with an increased length of stay, which again is a costly and a problematic issue for patients. So if I was still a clinical nutrition manager, as I had been some time ago, I would have really appreciated not only this information, but also would really look forward to hearing the staffing study results, which we're not ready to present yet, but will be forthcoming. So the idea being how many dietitians or FTEs, or I guess FTEs would it take to actually provide the care that's needed to identify these patients with malnutrition? And I know, Val, you had some thoughts as well.
I did. I absolutely agree with you. I think that the presentation in general was really validating of the great work that dietitians are doing with making sure that they're trained on identifying malnutrition using the criteria, and that everything that we are using is validated. So my biggest takeaway from the scope of the clinical nutrition manager was really to tailor your malnutrition data to base it on the people that are hearing the information. So making sure that when you're talking to the executive suite, that you're able to talk about the finance and the numbers and how much the dietitian's salary is, and how, what that one dietitian really impacts is from a financial standpoint. And then when you're speaking to nurses, they really want to know, like, why is this important to their patient? So being able to share the work that they do and how that impacts the length of stay and readmissions for their patients. So that was my biggest takeaway. I am very curious to hear the staffing piece as well, and I'm excitedly waiting that information to come out, because I think that's what the CNMs need. We need a validated evidence-based study that shares that information.
Thanks, Val. The last session that I wanted to highlight was a little off the beaten track, but it highlighted something that I've done in the past and that I would encourage others of you to do if you've never considered it. And that is, actually the topic was a fireside chat about dietetics and law. And it actually covered being an expert witness. Annalyn Skipper, who lives here in the Chicago area, spoke about that. And she encouraged individuals who have expertise to put themselves forward as expert witnesses or reviewers of cases. Clearly, you need to be qualified in order to do that, but it's an extremely, I've done it in the distant past, and it's an interesting and can be reasonably lucrative, although very time-consuming path to take. The other speakers, Annalyn she's a PhD RD, she's not a lawyer. The other two speakers were RD lawyers. And one of them talked about the impact of licensure laws to protect the public, which we know very well here in Illinois. We've had challenges over the years, and thanks to amazing individuals at the leadership level of the Illinois Academy, as well as our lobbyists, we've been able to protect that strong licensure law. But there was an interesting discussion about the value of licensure, the Florida case that you may be familiar with, the Model Practice Act that the Academy has developed, and something that's going to be talked about later this afternoon in an Academy webinar, which is the idea of a compact, a licensure compact, which would potentially allow individuals to practice across state lines. And they specifically mentioned military spouses, but certainly other individuals, perhaps a number of other individuals, would be affected by this compact. So it was a really fascinating discussion. And I thought it was a unique way to approach one aspect of dietetics practice that we actually don't necessarily think about as often.
That's super interesting, Mary. Did they have any suggestions for people that felt like they were qualified or wanted to get some more information about doing that, like steps to do from that standpoint?
They actually did. And of course, my app is on my phone, and my phone is sitting somewhere else right now. So
Definitely something to go and look at.
Definitely
sure.
Something to go and look at. If you haven't attended, I'm not sure what would be the best way for me to share that information with individuals on this call. Perhaps I could, I'm not sure, but perhaps I could grab it and somehow send it to Terry, and it could be highlighted in an upcoming newsletter or something like that.
That's a great idea. Okay. I know, Christine, you're ultra busy as far as it's lunchtime for the kiddos.
Here, okay.
You're okay.
I'm good.
Okay, great. Did you want to go next with which presentations you attended and what you thought was the most interesting?
Sure. A lot of them to choose from, actually. The first one I thought, just to kick off the FNCE with the fireside chat with the USDA director, Dr. Sarah Bleich. Am I saying that right? Bleich. The focus was the role of nutrition professional in achieving nutrition security and health equity. It was actually a follow-up to the White House conference that was on September 28th. Really interesting. I'm not sure if anyone was able to participate in that White House conference. A lot of great sessions there, but it was a nice, just a back and forth discussion with one of the Academy members. I think there's just a few key points that I took away with. She wanted to focus more on nutrition security, really looking at like having nutrition security nationwide. So having equitable access to food, not just food insecurity, but nutrition security in general. And recognizing that there is a challenge in our current structure, how we have in our current health structure, there is a challenge with disparities, having equality among food access. So that was one thing that resonated with me, that there is definitely a difference between nutrition security and food insecurity. The White House, actually across all departments are really adamant they want to focus on this nutrition security moving forward. Currently, there's not a measure to there's not a way to measure the impact, but they are working on it. She did acknowledge and sent kudos out to the dietitians for even in the Academy in general for our advocacy for nutrition security, for food insecurity, for sustainability across the board. So she did give a shout out to the Academy for our great advocacy in the past and moving forward. She did emphasize that is a whole government effort with this focusing on food security. She brought up was really a big thing that was brought up in the White House conference was healthy school meals for all. So universal school meals for all. Nationwide, as right now it's like could be state by state, it could be district by district. Right now my district they chose to make all of our 55 schools CEP. So what does that mean? It's community eligible provisions. So typically parents have to apply for free, reduced, or they would pay for meals. What the USDA wants to do is nationwide have universal free breakfasts and lunches for all. So they are pushing hard for that. It got declined back in, I think the legislation declined it back in spring. So it is coming up again. They're really going to encourage and hopefully it'll pass. Maybe it'll pass. That'd be wonderful. So we don't have to worry about having our kids go to school hungry, and they can get a free breakfast and lunch. So they are nourished and are ready to learn. She did emphasize that is a goal with the White House. So that was the first one that really resonated with me. The next steps actually, in addition to the school meals, she said that the next steps are to look at the WIC food package. So trying to kind of enhance and improve the food package there, looking also at the school meal standards just in general, try to improve those, which I'd be very happy with, simplifying it because there are multiple programs that I deal with and you could have different requirements for breakfast, lunch, and supper, which my brain goes kind of mishmash and kind of lose track of some things. So if it's standardized across all the programs, that would be ideal. And they're also looking for whatever our DGAs or dietary guidelines that are coming up. So they're looking for, they're promoting for the advisory council. That is the first session that I wanted to focus on. Did anybody else go to that fireside chat? Nobody did.
I did not take advantage of the fireside chats as much as I think next year I will. It sounds like it's a little bit, what would you say, how are they different in relation to the more formal sessions?
It's just an open discussion. They have prepared questions. So it's a back and forth discussion with the person. They have a couch, couches and chairs, more relaxed chairs, probably, Mary, than what you were sitting in for your session. Versus you're at a table and if you're at a podium.
It was a more formal, I liked the informal nature of it.
Yeah, so, but it was kind of more open and relaxed, discussion. That's what I got out of it anyway. The next
Great.
session that I could focus on, unless anybody else wanted to pipe in, I'm not sure if you went to that session, or Sarah, I don't think you were able to. I don't think you went to it. Okay. It was actually Mary's session. I really liked your session, Mary. It was on civility and ethics, especially right after the fireside chat. It was also on Sunday. I thought it's an interesting point of view because you had Mary that was speaking from a practitioner standpoint. You had a philosopher and you had a lawyer that was talking. It was an advocacy session. It was marketed as an professional standards and advocacy session. So as the Illinois Academy delegate, I really wanted to help focus also on advocacy in addition to school nutrition. But just a few key points that I took away, and Mary could even speak on it because it was your session, was just respecting all and having some positive dialogue so we could all have different opinions. We just want to listen, be open. Yes, we can disagree, but we want to be civil about it. Mary, I think you had an example with there was when you were in, I think it was medical rounds, a situation where you take a step back and you could have handled it better. So we all have to learn about we could have maybe misspoke, probably put my size 11 foot in my mouth sometimes. So how can we always, take a look at how did we speak? How did we act professionally? How can we do it better and remain civil to each other between the professions, within our own profession too. And just try to make civility infectious. I like that phrase that they used during it, and just appreciate everyone's differences. It's really what I took away from it. Mary, do you want to speak since it was your session? Sure.
Oh, thank you. No, I think you covered it really well. It was an interesting topic that because civility is mentioned in the Code of Ethics, but I think it's not the Academy's Code of Professional Civility is voluntary. And apparently there's some individuals who are writing ethics complaints related to civility. And so the idea was to make sure that we all tried to understand a little bit more what civility is and encourage people to embrace it. I was pleased that there were quite a few people whose heads were nodding, and it seems like, as we probably all know from listening to news and looking at Twitter and everything else, that there is a lack of civility across the country, and no one has a solution for it, but it was good to get the dialogue going. And one of the recommendations that I found in my reading was that organizations should start norming civility and maybe have, just like we have to discuss how to make sure that we don't get our computers attacked by phishing scams, we also should probably, in sexual harassment, we probably also should be talking about civility in the workplace. Thanks, Christine.
And so I was asked to just limit it to 3. I'll just, the last one that I'm going to talk about was on Monday. Was called Increasing School Meal Participation Through Student Menu Design. So, I was surprised by that since I'm in school nutrition, but I thought it was really interesting to hear. They had a couple people from, one person from Gen Youth, one of the food service director out of Louisiana, and they had a student. So how can you improve and enhance menu design by using students and getting student input, which is really important. So we do have youth groups here that we do some sampling, for some of our new products. So they did highlight what, using the students to kind of tap into what their voices are, what they like, what they want to see in the menu, not what I think is good or what my colleague thinks is good and healthy, and seeing what works. What resonated with me is, especially with the students, they did garner the input. They asked the students to come up with a project using, it was a venture capital grant, and they had a contest. So how can they kind of boost meal sales using the student input and student projects? They want to make every meal count. So they had some great ideas as far as what I could take back to try to use in our district, to just giving the youth a voice, because they are pretty powerful. So he had actually the student that spoke talked about his project about spicing up their options. So he and his student coworkers created a grab and go cart. So some quick and easy options, because what their biggest concern was at his school is that there's long lines. They didn't want to stand in line. They don't have a lot of time to eat. They only have literally 20 minutes for the entire meal period. So that includes standing in line and trying to shove food down your throat. So how can we get those kids through the line, get their meals they need, and they can have some time to eat and enjoy their little bit of a social time. So I thought that resonated with me, as I'm just trying to keep my eyes open, my ears open to what the students want, and just continuing to sample some products that I see coming through that meet the guidelines, first of all, but also hopefully taste good to the students. Yeah, that's about it. Those are my 3. I could have more, but I was told to keep it 3.
Thanks, Christine. Charlene, would you like to share your experience?
Sure, I'd love to. I have to say, I just love FNCE. Always have loved FNCE. I've gone to FNCE since I was a student in dietetics, and I just find that it's really inspiring. So one of the things I love this year was being able to talk to the other presidents and president-elects from all the other states. Sarah and I ended up attending a session with those other from, South Dakota, Tennessee, Wisconsin, you name it. And kind of found out we all have similar challenges and similar things that we're concerned about. And so to me, that was really a highlight. But Val, you've asked me to talk about sessions. So I love the trade show too, but I'm going to talk about sessions. And one of the top ones for me, I have to say, was hearing from Ginger Carrick. Ginger was with the NASA Space Center, and I guess I'm a sucker for inspirational stories, but she was just amazing. She came out and shared her story of how she got where she was, and she really navigated change, disappointment. She had lost her father at an early age. She knew at the age of 5 she wanted to be an astronaut, either that or a basketball player, and she decided on the astronaut. But when she went, and she was very smart, she went to take physics, and the physics instructor, the first thing he said to her was, girls aren't allowed in my class. Yeah. And so this was after she'd lost her dad, of course, and she was just like, oh my gosh. So ends up along sexual harassment kind of thing. And, he could have been fired, but she actually knew she needed physics to get to NASA. And so she said, no, don't fire him, because there won't be a physics teacher. Let's just make him learn to change. And so he took some classes. So that was kind of evident all throughout her life. Rather than accept the setback, she found a way to overcome it. So fast forward a little bit, and she's now ready to be an astronaut, and she's going for her evaluation, her physical, and of all things, they find kidney stones. And an astronaut can't have kidney stones. And she was, again, just devastated, cried for days. And then she thought, okay, I got to turn this into something good. I just love that can-do attitude. And so she became, if any of you saw the space movies, she became the first non-astronaut and female director of mission control, which was just amazing. And she said it was just so incredible. She ended up with a 30-year career at Johnson Space Center. Just so inspiring to push ahead, no matter the obstacles, push ahead, find another way to view whatever the obstacle is. So that was definitely my favorite overall. My second, I went to one on menopause and metabolism, because I see a lot of patients, a lot of women who just struggle with weight loss during menopause. So it was led by a lady named Elizabeth Ward. She was one of the speakers, and she has actually written a book, The Menopause Diet Plan, A Natural Guide to Hormones, Health, and Happiness, which of course now I want to buy that book. But she talked about 3 main stages, kind of the pre, the menopause, the after, and then how your hormone levels all affect that in the development of chronic health conditions like diabetes, or, being overweight, or osteoporosis, or heart disease. So she kind of tied it all together, and then ended up with some positive lifestyle habits to reduce those risks, which a lot of those we know. And yet I think one thing she brought out that really resonated with me was to realize these women going through menopause that may be our patients, they have a lot going on in life. You know, they may be still caring for kids, teenagers, you all, for those whose kids aren't teenagers yet, you know, that can be a stressful time, and aging parents. So we have to realize how much stress plays a role in all of this. So anyway, I learned a lot from that. The third one I really liked was, I see a fair amount of cancer patients in my practice. And so the American Cancer Society has come out with 2022 nutrition and physical activity guidelines for cancer survivors, hot off the press. So, you know, they gave a lot of reasons for physical activity, and that probably has to be the last thing you want to think about when you get a cancer diagnosis. And yet they really reiterated just how important it is to maintain, you know, it helps with fatigue, which is the most common side effect of cancer treatment. It improves the symptoms of depression and anxiety, which is also huge in a cancer patient, improves sleep, which is important, helps maintain physical function, improves the immune system. So the goal, you know, this seems like, wow, we're talking cancer patients here, but 150 to 300 minutes per week of moderate activity, or more vigorous 75 to 150. So I know you guys, this is all familiar, right? And then 2 times a week resistance. And for those who just, you know, can't do much, just to sit less and move more. You know, movement is the new medicine, even for a cancer patient. And I think I just didn't really think about that enough. We know we need to move, but we know our patients need to move too. And it's not just about weight loss. It's not just about, oh, because we heard this is what you're supposed to do. There's valid reasons for doing that. So those were my top 3. Like I said, I just always get inspired by FNCE, and I am very grateful that as one of the things, when you get into leadership with IND, when you're president-elect or president, IND helps you go to, they fund your FNCE. So this is, if you've thought about leadership, I just want to encourage you that this is a perk that you can do, and you learn a lot, and you get to talk to all your peers who are in leadership at different states as well. So I just found it to be really, really beneficial, and I'm so glad I went.
Thank you so much, Charlene. Sarah, would you like to share next?
Yep, I can go. So I'm going to just share 2 of the sessions that I went to. The first one I went to, it's like a brief behavioral intervention for change. It talked about 10-minute strategies for dietitians to use. I actually attended that one with Charlene. And I think that one resonated with me because it was a psychologist or a psychologist that had gotten up there and talked about how to not make your patient or client change, but how to help move them from like more of a pre-contemplation to a contemplation. So, you know, if you think about your most difficult patient, if they come into your office, you say they're sent there because their provider told them they had to be there. And then kind of just talking a little bit about how to get them to think about changing, not necessarily change, but think about changing, and how to script your words in a way that kind of helps them and guides them to kind of identify changes that they can make, even if it's just kind of thinking about, maybe in the future I'll maybe make a change. That was a really good session, because I see a lot of patients and clients out here in rural Illinois that probably have very low income, very low education status, and they're not really sure what to do, or they come into my office, they don't want to make any change, they're stuck in their ways. And so it was just a really good session to do. And then there was also like a workshop that attached with it where it said like, ask your partner questions and stuff. And I sat there and talked with Charlene. So I also see a lot of diabetic patients, and a lot of them come to my office and say, I don't know what to do, and diabetes is so hard and it's not fair. And I wasn't sure, I, as a young dietitian, I'm really not 100% sure what to say to those people. So it was really just a kind of a good workshop. I sat there with Charlene for a while and we kind of discussed her expertise and things I can say to my clients. So that was a really good session for me. Charlene, do you have anything about that session?
Well, I disagree. I agree 100%. I learned a ton in that session about, we're so quick to share what we know because we know, right? And we want them to know. But honestly, what helps them change is for them to see, oh, this is something I could do to change. So even if something as simple, and I caught myself doing this yesterday when I was seeing patients, they had maybe lost some weight and I'm like, oh, usually I would say, I'm proud of you, but you know what? It's not about me. It's about them. It's about them understanding you did this, pat yourself on the back, because so it's just that kind of that change in thinking and to ask those questions, to have them buy into it, because so our role is to kind of guide that conversation, but their role is to actually, for the light bulb to go on and see, oh, I could make this change. And even if it's just one change or two changes, that's progress.
Yep. So that was kind of one of my favorite sessions, because I think I can really use that in my practice, even if you just see somebody for a quick 10 minutes or 5 minutes, just kind of a way to script your words and talk to them about how to think about change. And then the other session I attended that I really, really liked was on Monday. I attended, it was called The New Malnutrition Impact for Staffing and Supply Shortages. So it was like a panel discussion, kind of like today. They had a dietitian who worked in inpatient care. They also had a dietitian who worked in long-term care. And then they also had a dietitian who worked more with supply chain and food service management. So I kind of can see all those perspectives, because here in rural, I do everything. So I do clinical, I do inpatient, outpatient, I do our food service. So I attended that session. They talked about malnutrition and how it's impacting everybody. So from an inpatient side, they talked about how, there's nursing shortages. And because there's nursing shortages, your weights aren't going to always get done. Your percent meal intakes are not always going to get done. Maybe the labs take longer to get ordered and things like that. And they kind of talked about us as a dietitian, what can we do to kind of help alleviate that? Maybe going and picking up trays and recording the meal intake in whatever system we're using. Or maybe if the patient can stand and it's not a fall risk, maybe you get the weight or you bring in the scale. So it was just some really good information. They talked a lot about food service, which was a highlight of mine because we have a lot of supply chain issues. Last year, we had issues with getting cups, issues with getting peanut butter. Ketchup was an issue for a while. So they talked about what you can do with supply chain issues, changes you can make, and then also issues with staffing, which I'm having issues with staffing right now. So it was really interesting, and maybe even seeing if your inpatient or your outpatient dietitian can come down and help deliver a tray or two, or even just help put some items on the tray. And just really communicating, the dietitian also with the dietary staff, because they are the ones who actually are taking the trays up there and delivering them and seeing kind of what the patient orders, or can suggest things on the phone. So that was really helpful. I kind of like those sessions the best. Those were really, really important to me in my work.
Sarah, I agree with you. I went to that presentation as well, and that was a big takeaway and something that my team and I have discussed afterwards, because I felt like a huge theme that I heard was, how can we do more with less? How can we collaborate? How can we really learn what our peers do and support them? So the weight thing was something that I've already discussed with my team. The weights are a big challenge that we have, especially daily weight. So not that the dietitians can get weights on every single patient, but those patients that are on their list and they're already in the room, can we get cross-trained on how to get bed weights as well? So I was really inspired by that presentation as well. And it was nice to hear that we're kind of all dealing with the same things, and how can we learn different tips, and how can we be an even more valued member of the team by, helping out our nursing partners, because there is a huge, especially, those weights are usually a tech. So it went from, a 1 in 12 ratio to some of those techs are, maybe covering a unit. So it's 24 patients, or maybe covering 2 large units. So they're stretched very thin. I think they'll be appreciative of anything that we can do to help them with that. Okay, so to kind of bring it home for me, the presentations that were most inspiring to me, there was this really great one on the last day. It was called Cultivating a Growth Mindset. And really it was Cultivating a Growth Mindset, the Path Towards Continuous Improvement was the name of the presentation. So the presentation really shared the work of Carol Dweck, who it sounds like has been doing this research a long time, and her research was spotlighted in the 70s, and then she's done even more information since then. So my takeaway was really focusing rather on saying no for something that you're interested in but you may not have time for, but using not yet. So really thinking about prioritizing what's important to you right now, and then thinking about when you can make those other things that are a priority to you in the future. And then as dietitians, a lot of us are type A. We're so focused on if we obtained the end goal, and the presentation really talked about celebrating those small process steps, and really congratulating yourself on the process, because we all know that especially big projects, there is a 1 to 2 year process until we get to those. So making sure you're celebrating that along the way. So I thought that was super interesting. So interesting that I went and YouTubed Carol Dweck because I was interested in just some more tips that she had on that whole growth mindset. So that was super interesting to me. And then the other one that I thought was interesting was a presentation called Innovative Interprofessional Education Practice Strategies, a Recipe for Success. And it was one of those presentations, when you think you're going into one presentation and it's something totally different, but you still get information out of it. So the presentation was really geared towards educators and people running programs of education. But what I took out of it was just that theme again of making sure that we're learning what each discipline is doing. And they had a whole presentation on journal clubs, and what they do on the education side is they include all of the different programs, and healthcare professionals do this huge like Blackboard event with discussions. So there might be a speech therapy student, a dietitian student, a physical therapy student, and they all participate in this semester long journal club. But what I took away from that is we could absolutely do that on the inpatient setting too. We already do journal clubs with the dietitians, but it made me kind of think bigger, like how can we pick topics that more areas that are on the clinical side would be interested in that information. Some ideas that I thought about was different ethic topics, and I have to think more about what more than just dietitians would be interested in learning about. So I thought that was super interesting, as well as maybe getting topics from a different lens, like what would a speech therapist find interesting, but the dietitians and other areas need to know as well. So that one was super interesting. And we already talked about the malnutrition lecture. So I just wanted to pause. Thank you, Mary, for sharing that with everybody for Carol Dweck's name. Did anybody else go to a presentation that's on the line that we didn't talk about that you were really inspired by or you thought was interesting? Okay. So let's go to the next topic. And the next topic was on poster boards. And, you know, FNCE is so jam-packed. And I felt like this year we all struggled with getting to all of our sessions and the expo and going to all of the poster boards. But I just wanted to take a minute to see, you know, what did you guys see and what were you most inspired by? For me, I really love the poster boards because you know, it allows us to steal shamelessly from each other with new processes and make those connections to hear like, oh, that's a really great idea. Tell me more about that. And maybe I can get your contact information so we can chat more about like my ideas and how your project would really help me facilitate a similar topic. So if you guys don't mind, there was one poster board that I wanted to share with everybody that I found really inspiring. And it was around, I can't remember the name of who was doing the poster board, but it was sharing about how to really make a more inclusive nutrition support committee and how they specifically facilitated making sure that the dietitians and the pharmacists and the residents and the attendings were all working together and smarter so that there was less of that. I know we've all had this where we've got our whole plan done and it's 3 o'clock and the physician or the surgeon changes the plan and then we have to do something completely different. So it was really interesting having that conversation with her and what they've done and just kind of maybe some camaraderie there with that and bringing that back to my team from that standpoint. So I thought that was super interesting. Would anyone else like to share what they saw with the poster boards and what they found super interesting?
Val, I saw one, it was on culinary medicine at the University of Nevada, Reno, their School of Medicine, which of course, you know, it was interesting to see what they were doing. And so what the poster and their research was on introduction of a culinary medicine curriculum to increase confidence and competency among preclinical medical students. So this is exactly what we're hoping to do at SIU Med School here. So the research found that medical students knew what a healthy diet entails. They had that down, but they felt much less competent about counseling patients about nutrition, about actually cooking, their own eating habits, and much, much less confident about prescribing nutritional interventions for disease management. Well, of course, that's our job, but I just found that interesting that, you know, kind of the more they delved into it, the less confident they felt. So it gave, it just made me feel like, yeah, there's a real need to be doing this, and their research kind of backed that up. So that was really my favorite one. Although I agree with you, it's just fun to go through. And the interesting thing about FNCE, if you haven't been for a while, they change, you know, so Sundays, poster boards were completely different than Mondays, which gives a lot of people a chance to show the work that they've been doing. So I think it's great.
That's awesome. Charlotte, I saw that poster board and I immediately thought of you because I know that's an interest of yours.
Love it.
Sarah or Mary or Christine, was there any poster boards that you thought were super interesting or helpful for you?
Well, this is Mary. There was one that I thought was fascinating, and perhaps people on this call won't necessarily disagree with this, but it was about the imposter phenomenon, which I think we've all heard about in a variety of ways. And it's the feeling of being undeserving of the success that you might have due to the perception that it's either luck or chance versus your skill and experience. And this individual surveyed 5,000 RDs, of which only 266 completed the survey. So it's hardly a huge sample, but more than 76% of these RDs had at least a moderate level of imposter phenomenon. And it was just really interesting to think about why this would be. I didn't get a chance to actually speak with the poster creator, which I wish I would have been able to. But she noted that there was a huge potential negative impact on practice and outcomes if people feel that they just aren't deserving of their success. And it might impede their ability to move ahead, which is obviously not impeding the ability of all of you to move ahead, but it's apparently quite a phenomenon, which I think is concerning. And I would certainly wonder if educators and others might be having to think about how you might address this, or even clinical managers, to try to improve confidence and maybe do some of the stuff that you were talking about as far as Dr. Dweck's thoughts.
Great. I know we're getting close on time, so I definitely want to respect everybody's time, but I did want to jump forward really quick to the topic of cost. I know we talked a little bit about leadership and that being an option of ways to get FNCE covered, but I also wanted to just open it up to the group on additional ways where, you know, if even as a new RD, of ways to get FNCE covered, utilizing some of those academy resources. Did anybody want to share from that standpoint?
Well, I think before we started today, you were mentioning some student scholarships potentially that, and even when people register for FNCE, there's an opportunity to sponsor a student, but we really don't know how that all kind of synced together. So need to learn more about that, but there may be some scholarship opportunities through the Academy Foundation. I'm thinking even for just for our own workplaces, if we can justify, try to, if there's something that the Academy can provide us to justify the cost of sending us to FNCE, or at least cover part of the cost. I mean, it's for our continuing professional development to be Ms. top in our field. I'm not sure if that exists or not. I've always had the opportunity to have it, you know, through who I was working for at the time, or through the leadership has sent me through West Suburban and even Illinois Academy. So, but definitely looking into student scholarships and potential opportunities from the Academy that we can help fund our way, at least partially. Because it is not, it's expensive.
That's a really great point, Christy. And I think the other thing I wanted to share as far as scholarships is, as you guys become more involved in the dietetic practice groups, a lot of them have scholarships as well, so that's helpful. And, you know, I think maybe that might be a newsletter topic that we could maybe talk about a little bit more, is ways to get things covered. I think that could be really interesting for us to maybe look at some of the Academy and Illinois Academy resources.